Ria, tell us about yourself. What do you do for a living?
So I am a personal injury attorney here in New Jersey, and I also practice in New York as well. I was actually a former patient of Dr. Bo's way before I was a personal injury attorney or knew anything about the personal injury law.
Ria, were you struggling in everyday life with normal activities before you went to the doctor?
I was 24, and I had just been experiencing a lot of lower back pain for years. And then eventually it got to the point where it started to radiate into my legs a little bit. And I was like, all right, I need to go to the doctor. And he comes in and he sits down. He's like, what did you do to your back? I was like, I don't know, And he was like, your MRI says significant mass effect. So he's like, when I see those words, I want to see the film. And he was like, you see that dark space? I'm like, yeah. He's like, it's not supposed to be dark, so I'm sending you to the surgeon. I was like, uh-oh. So he sends me to Dr. Bo. So I go and I see Dr. Bo, and he's like, oh my God, what did you do to your back? I was like, why does everybody keep asking me what I did to my back? I don't know. And he said to me, I don't tell people surgery on the first visit, but I'm telling you surgery on the first visit. So you can either do it in 2 weeks or you can do it in 4 weeks.
Wow. Okay, so what were you feeling in that moment when he said you had to have surgery?
I was shocked, and I didn't think that that was going to be what he said to me. So I was shocked. I was scared. I cried on the ride home, because it was just, I didn't think it was as serious as that. So pretty scary.
What were you feeling leading up to your consult with Dr. Okubadejo?
So one of the things I saw when I went into his office was this article that said he's a proponent of minimally invasive procedures. So I was like, okay, he's not just someone who wants to cut just to cut. And then I also went back to my primary care doctor, and I was like, oh, so what do you think about this surgeon, And like, he's telling me surgery. He's like, yeah, he's not a guy who's going to tell you need surgery when you don't. And so he kind of reinforced that with your condition, you need surgery. So that kind of made me feel better.
What were your concerns when Dr. Okubadejo mentioned that you had to have surgery?
I showed up at the hospital. They prepped me. He came in, ready to go. I woke up in the recovery room, and I heard his voice, like he was there. And he was like, how are you feeling? And I was like, a little cold. And then they put something in the IV, and then I wasn't cold anymore. He was there and made me feel at ease before going in, and then, coming out, it was fine. And then I was back to work in 2 weeks after the surgery. Walking, no back pain that I had for years was completely gone.
Wow.
I still had to do physical therapy for my leg because I had weakness in the leg, but I did about 4 months of physical therapy, and then I got to the point where I could sustain my work day. Beforehand, I couldn't sit for too long. I couldn't stand for too long, and I was, I had a lawyer job, a desk job, so I'd be at my desk writing, and then I'd have like a pillow under the seat, or then I'd have to stand up, and then I'd stand up and I'd be writing, and then I'd sit down a little bit. But after surgery, I could sit and sustain my workday, no problem. And that's what I wanted.
Is there anything that you'd like to say to anyone who has back pain, who might need to have surgery, who's scared about moving forward?
So it wasn't probably about a year or so after surgery where I was moving in a way that I wasn't thinking about it. So like when I pick up the laundry basket, I didn't have to think about how I was doing it. And then eventually I went back to like running, Zumba, yoga, got back in the heels, like no issues. And then when I told people I had back surgery, like, you had back surgery? I'm like, yeah. And I had a great experience. So back to work after 2 weeks, 4 months of PT. And then within a year later, resuming all activities. And so before surgery, I couldn't get out of bed in the morning. Like, I could not go from laying down to sitting up. I couldn't do that motion. I had to roll over and then push myself up from the bed. So for me, it was a life changer, and it was definitely something that I needed. And the result was great. If a surgeon or, like Dr. Bro is saying, hey, you need surgery, it's because you actually do, right? And you'll know it. Like I was in a situation where I couldn't get out of bed. It was painful to like walk. I couldn't function normally. So that's not something that should be your everyday life when you're 25 years old, right? And for me, living in that pain for the rest of my life was not an option. I was like, this is not something I can sustain. So is surgery risky? Yes. But then I had a doctor who was like, I'm gonna do the most minimally invasive, procedure that I can, that you're a candidate for. And then I talked to my doctors, right? So it was really a team effort.
What about Dr. Okubadejo made you feel that he was the right surgeon for you?
I'm living and walking proof of his work, right? So he fixed my back. I had years of back pain that I just thought was normal, It really changed the trajectory of my life. And then I actually discovered that I had the problem, right? Had I not gone to the doctor, he essentially gave me my life back.
I want to talk a little bit more about Rhea. She really had a glow up before and after her surgery. Tell us more about her injury and about kind of her road to recovery and what's happened for her since.
So when I met Rhea, she was a young attorney, just getting started in practice. She had a lot of pain in the back, radiation down her left leg. She had weakness, just very concerned. And I knew that as a high-level person, as a high performer, she needed to be able to get back to just getting her career going. So I was very clear with her imaging, her MRI. She had a large herniated disc, L5-S1, impinging on her S1 nerve root, a lot of pain down the leg. She had a weakness developing already. So I explained to her what was going on. I let her know the options. I felt that if we waited for too long, that she could potentially have symptoms that may persist longer than we would want, that could potentially inhibit her going forward. So we decided to get it done. So I did a procedure called a microdiscectomy. So usually with that, I use a microscope, small incision, I work through tubes, take a little bit of bone to get down to the spine. I found the herniation, took that off the nerve. The nerve had great decompression. So I felt very confident during the procedure and after that I had accomplished what I needed to. And postoperatively, she did great. She had almost immediate pain relief. She was walking much better. We started her doing physical therapy 6 weeks post-op. And now you can see how great she's doing. I mean, it's amazing. Like she's in court, like she has all these great cases, a very busy practice. I'm very proud of her and proud of myself for contributing to her being as great as she is.